A lot of students and adolescents get better and they return to school with no issues. Some of them will sustain a concussion on Friday and they're back to school on Monday and they don't need any supports. Those aren't necessarily the students that I see. My name is Heather Shepard, and I'm an assistant professor in the School of Occupational Therapy here at Western. There are quite a lot of concussions that are happening in adolescents. There's some data from the States that says that over an adolescent's lifetime, about 1 in 4 will sustain a concussion. Returning to school following a concussion is a lot, I think, for a lot of students, and it very much varies by province. So in Ontario, we have Rowan's Law and Policy and Program Memorandum 158, which outlines that schools should have concussion policies and protocols in place and gradual return to school and physical activity supports. What that actually looks like in practice from the student could be very different. Not all students know their schools have those policies or protocols in place to support them in Ontario, or their parents may not have the health literacy to know about it. What I recognized was that not just students with concussions, but all students, but there wasn't the resources in place, let alone the knowledge or awareness. My goal as a researcher is support adolescents to get back to the things that they want to do, playing sports, socializing with their friends, need to do, going to school, in a way that is supportive of them and is practical and feasible for school and sport organizations. During my PhD, I designed the Return to School framework, which is a holistic approach to return to school for students. So it aligns with best practice, so concussion policy and protocols, also includes a peer support program, which is something that our adolescents said that they wanted as part of their return to school, and identify some of the key components from an implementation standpoint. So what does communication look like within the school and then from school and home? And now as an assistant professor at Western, where I'm carrying the work forward, looking at implementing and testing it in real world settings in Ontario schools. Hardest thing for change, resources. Schools are by and large very limited in the physical space they have, the financial resources, personnel resources, and these programs cost money. They take time. I think we're going to fix this through engaging with adolescents and the individuals who support them. By engaging the people who are living the experience, I think we end up with programs that are more realistic, more practical, and more relevant to what their needs are. Being able to see that there's a really wanted a need for these programs and that people are excited about them really helps fuel the fire to do more, to engage more, to build more, and to do it in a way that aligns with the people really just going in, being curious and being open and being willing to listen to that individual and hear their story is the most important part.